The EasyGlide ovals reduce strain and potential injury to patient and caregiver by easily allowing a caregiver to apply or remove a sling from behind a patient without log rolling, pushing, or pulling on them, whether the patient is lying on the bed, the floor, or sitting in a wheelchair, stationary chair, or car seat. The EasyGlides also reduce shearing in both the application and removal of a sling. EasyGlides are also used for other applications when reduced friction is needed to transfer patients. Prior to using the EasyGlides, visually inspect for excessive wear and damage, i.e. sharp edges and/or broken handles. If damaged, remove the EasyGlide from service immediately. Follow your facility policy and procedure for discarding damaged or worn products. Before using an EasyGlide, all operators should carefully study and understand the instruction guide and complete the EasyGlide competency checklist. In addition, the patient care plan should be reviewed for patient's activity level and any contradictions for using this device. Assure that the use of equipment and accessories are in full compliance with the patient's care plan. Regularly check the product for damage. Routine cleaning of the EasyGlide ovals should be done with common surface disinfectants such as water-based ammonia compounds or quaternary compounds. Do not use products containing phenyl or chlorine, since the glides may be damaged. The EasyGlide ovals come in a set of 2. Place the 2 EasyGlide ovals together for sling application. The EasyGlide ovals are flexible and can therefore work in many different situations. Prior to using the EasyGlides, check to make sure that the patient doesn't have any spinal deformities, skin conditions, recent surgery, or other procedures that would contraindicate the use of the EasyGlides. When applying the EasyGlide ovals in all situations, always try to find and aim for the lower back lumbar area of the small of the patient's back. This is a natural arch that is present when the person is in a recumbent or supine position. Place your fingers slightly in between the patient and whatever surface they are lying or sitting against to create a small starting gap. Put the 2 EasyGlide ovals together and gently place them between your hand and the other surface. Smoothly push the EasyGlides to the middle of the patient's back and rotate them up towards the head, parallel with the patient's back. Take the sling and put it in between the 2 EasyGlide ovals that are underneath the patient. Using proper body posture, pull the sling down behind the patient on one side and with another caregiver doing the same on the opposite side. Do this slowly and carefully all the way until the sling is down to the patient's tailbone. If there is too much sling on one side, adjust it so that the center of the sling is aligned with the spine of the patient. Remove the EasyGlide oval that is between the patient and the sling. Now, you can apply the sling per the sling instruction guide. Some wheelchairs and chairs will not allow access to the lower lumbar area and the small of the patient's back. Therefore, you will not be able to rotate the EasyGlide ovals up to align parallel with the patient's spine. In those situations, come straight down behind the patient's back with the EasyGlide ovals. Place your fingers slightly in between the patient and the back of the chair to create a small gap. Place the EasyGlide ovals together and gently begin to slide the oval set down behind the patient's back with the EasyGlide ovals being parallel with the patient's back. Push the EasyGlide ovals down until the bottom of the set aligns with the tailbone and the patient's head. Put the sling between the EasyGlide ovals from behind the chair and pull it down to the patient's tailbone, being careful not to strain your back. Walk around to the front of the wheelchair, place the sling on the inside of the wheelchair and inside of the patient's arms. Remove the EasyGlide oval that is between the patient and the sling. Now, you can apply the sling per the sling instruction guide. If you have any questions or comments, please consult your local distributor or system robotic specialist.